what we bring to the table are opportunities for research and development, creative activities that would enhance, build out, and allow for innovation in community programs. We're able to create a pipeline of new professionals who are interested from all the disciplines, who are interested in homelessness and who bring a specialized commitment to this. We're able to help think about policy options. There are a lot of them out there, as all of you know, but I think we have a capacity through some of our research institutes and elsewhere and our community partners to generate additional ideas. We're interested in helping hungry and homeless students, not just on our campus, but in collaboration with other institutions across Los Angeles. So this is something at home that we need to be thinking about.
I am here to introduce our panel, which is about developing capacity in the workforce. I'm the Dean of the School of Architecture at USC. Our school has been pleased to be a part of this initiative. I've only been here 9 months. Of course, as I was interviewing for the job and coming to LA, I saw the homeless problem and looked at it in very close proximity. And I've been very impressed in the short time that I've been here to learn about the commitment of our university, the commitment of our deans, and I've been very pleased to be involved in this effort. Our school is heavily invested in issues of urbanization, housing, and inequality. We ran a design studio last year with students, very successful on homelessness, and we'll continue to do much more of this work going forward, and under the leadership of our great Marilyn Flynn, the Dean of the School of Social Work, that's been doing a great job. So thank you all for being here.
I've been working in homeless services for about 15 years, and that entire time in homeless services has been, I've been fortunate to be working in organizations and times of growth. I started off working for a service provider and housing developer that experienced, quadrupled its budget in 3 years. And then I moved on and worked with the VA at the beginning of the VA's homeless initiative, and came to LASA about 2 years ago now. And obviously, there's incredible growth happening in LA right now. Just LASA itself, in FY 15-16, we had a $72 million budget. Now, 2 years later, we have a $243 million budget with tripling the number of staff. And most of the funding that comes to LASA goes right back out to our service providers. So we knew, with this sort of incredible ramp up, that a lot of attention was going to be needed to be building out the infrastructure and the capacity of our entire homeless services delivery system. And that really has to begin with the community-based organizations who are on the ground and doing this work every day. So I want to share a little bit about what LASA has been doing in partnership really with the county, with the city of LA, and with the Home for Good Funders Collaborative. That work started about 2 years ago, really with looking at training, what could be done for training, what could be done with working with the workforce development system, and doing some organizational assessments of the community-based organizations and what their needs are. And that has now really enhanced into, we have a capacity building unit within LASA, 3 members strong, that are tackling this in 3 areas. So one is really on hiring support, and probably as I mentioned already today, there's over 1,000 jobs that are vacant in the homeless services system right now, and we need more people, to fill these jobs so that we can, be serving, really putting these dollars to the best use and serving people. So, there's been centralized job postings, hiring fairs. The second one of those happened in partnership with the city of LA and the county and United Way last Friday, with over 750 job seekers that came out. Working with colleges and universities like USC about, really really enhancing the pipeline of people into the field, and then really looking now at what we can do to be just providing some recruiting support, just bringing recruiters into the work. We also really built off of this is what we do often in the homeless system, right? So innovation happens in the private sector with philanthropy. So through Funders Collaborative, there was a start of Centralized Training Academy. We've now brought that in through funding through Measure H into LASA and really enhanced it. So now there's a Centralized Training Academy that provides training at all levels so for direct service workers who are entry level, more intermediate work, and then now for supervisors, and enhancing that further with more enhanced trainings across the field. And then it's really important to be looking at the investing in the actual organizational infrastructure of the community-based organizations. And so we did some assessments of some of our partner agencies about a year and a half ago, and found the needs are really varied. And so this past spring launched a new initiative for agencies to be applying at a joint application that's between LASA and the United Way Funders Collaborative, Home for Good Funders Collaborative, where agencies can articulate what their needs are, get their own sort of organizational assessment, professional services to implement the recommendations that come from that assessment, but at the same time be applying to private funders for other kinds of one-time costs, like enhancing IT infrastructure, building out office space, those kinds of things. So really trying to look at this from a holistic sense. So that's some of the work that we're doing on that capacity building work. But I think also really taking a step back and looking at our overall homeless delivery system, or homeless crisis response system. And so something that LASA did, with this incredible growth, is really looking at our organizational structure and what we needed to do to really move our work forward. And so we did some restructuring. We created a coordinated entry system unit, which really helps LASA step into the place of not just being an administrator of funding, but really a leader in helping to facilitate the coordination of all of these services. So we now have a coordinated entry system unit that's really focused on that work, and how do we integrate this? As you all probably know, funding for homeless services for years has come down in a very siloed way, which then translated into siloed services for people on the ground. And the whole intent with the coordinated entry system is how do we blend all of that together to make it so that the safety net is as tight as possible and people don't fall through, and that when people are navigating through the services, it's as seamless for them as possible. And they don't feel the effects of having all those different types of funding that might be serving them. The Hilton Foundation funds an evaluation of the coordinated entry system. And one of the comments that's come back through that work, this is sort of my mantra now, is, so what has CES done? I was reflecting back on the work of what CES has done. And one of the comments from it is that CES really took the burden that the person who's experiencing homelessness, that they face in trying to navigate this system, and it took that burden off of the people that we're serving, and it put it onto our service providers. And that's a really good step, right? That's a good step. Our work now is to lift that burden off of our service providers, untangle this web, and make things as simple as possible. So that's the work that we look forward to continuing to do with all of you and our partners out there doing the work.
Hi, my name is Brett. I'm a physician assistant and director of street medicine for Keck School of Medicine. Street medicine was founded on the basic idea that everybody matters. And when we start there, we see that the homeless population just cannot access healthcare the way other people do. If you don't know where you're going to sleep tonight, where your next meal is coming from, and if you're going to be safe doing those things, then you can't possibly begin to think about things like your healthcare. So in response, we designed a whole nother healthcare delivery system to deliver care directly to them on the street. Not just the visits, but we'll dispense medications on the street, draw labs on the street, so we know for sure that they're getting what we want them to get. But more than what we do is the how and the why that's important. So these are the founding principles that we base everything off of, from programmatic ideas to down to the patient level. So the first one is the first one I mentioned, everybody matters. The second one, which is the mantra of the Street Medicine Institute, is go to the people. There's no better place to demonstrate this than Boston Healthcare for the Homeless, who's the best program in the world. In one street corner, they have a traditional multidisciplinary, multi-specialty practice that's specifically catered to the homeless. Across the street is a 600-bed homeless shelter, and they've co-located a clinic inside that shelter. But the river that runs between those two clinics are the street team that serves those people that are unsheltered, the rough sleepers, sleeping on the street. So in one city corner, you have one organization that's providing 3 different methods of healthcare delivery based on how the patient prefers to get their care. And the last one is to be able to share in their suffering and do so with joy, not with grumbling. And it's only then that they'll know how much we truly love them and care for them. This is not like a warm, fuzzy love. This is like a love with grit. This is a love that bails their tent out after a rain, or sits next to them on the bus in solidarity as they're being harassed or verbally abused by the other people riding the bus, but there you sit as friends. And after that happens, then both of your sufferings dissipate, and you're left just with the joy. So this is a picture of my team. Obviously me, Corinne, who is over there. She's a teacher in the PA program and works with me one day a week on the street. Dr. Lo Henry is a director of the PA program and introduced me to homeless medicine 15 years ago. And Janai Robinson, who is chair of family medicine and my attending physician. So I just want to share a little bit about what our vision for USC Street Medicine is and how that's going to help create a pipeline of providers. So first, in terms of homelessness and healthcare, their life expectancy is 42 to 52 years. 38% have 2 or more major physical medical illnesses, 25% with severe mental illness, and 30% with a drug use disorder. In terms of mortality, top 3 causes of death, number 1 is drug overdose, but not far behind is cancer and heart disease, both which would benefit from primary care and preventative medicine. So there's certainly a role for us on the street. The good news is that we know this model works. This is some data from the previous program that I started showing that in terms of hypertensive management for all of FY17, our practice actually outperformed the traditional practice, while improving healthcare utilization, decreasing ED visits by 73%, total hospital admissions and readmissions by 64%. So how this fits into the wicked problems is that USC's vision was to harness the talents of every school and to encourage collaboration, coordination, and education. As you've already learned today, street medicine is just one of those examples of that vision in action. So what we're looking to do is, for the students, transform the core values of USC into core curriculum, so that when they graduate, they can transfer that core curriculum into their core values as professionals and providers. How we're looking to do that is using the classroom of the streets, and there is no better classroom than the streets. But there are a few rules that we need to follow. First, it must be not just multidisciplinary, but transdisciplinary. We need to learn some of each other's jobs because resources are scarce. So if a patient needs a social worker, I don't have a social worker with me, I need to fill out help them navigate the system and fill out some of that paperwork with them. It needs to be immersive. A one-time street experience will not create a pipeline. It needs to be supportive. We have to train them before they go out, and then when they come back, we have to debrief them properly so they know how to assimilate what they just saw. And if we can do that, it can be transformative. We're also creating a street medicine fellowship that'll be designed for already practicing providers who maybe already see homeless patients in their traditional clinics and teach them the art of street medicine, complete with alternative clinical guidelines. We also plan on hosting a LA Street Medicine Consortium. The role of this will be to bring providers in multiple spas together, help coordinate patient care, and also serve as a support for each other in our work. But there's lots of challenges that you already heard about, volume, coordination, but the one I want to mention is the commitment to the street medicine model. There's going to be pressure to retreat from the street, whether it's because of high volume, convenience, or billing, but we need to stay committed to the model that we know works. So finally, if we're not just looking to build a pipeline of providers, but maintain a pipeline. We need to reframe how we measure success. This patient, by all traditional measures, was a failure. We never controlled his blood pressure, never controlled his COPD, never got him off alcohol, and never got him into housing. He spent the last of his days on this bench, and when he was admitted to the ICU, we came to see him through our consult service. We helped connect him back to his estranged family after 15 years. He eventually decided on comfort care and passed away peacefully in the hospital while holding our hand. Afterwards, his body was given back to his family, and he received a family burial rather than a county plot. And finally, for the best measure of success is Pappy here. Pappy believes that street medicine is just as much of a part of street culture as he is. This is him panhandling in his street medicine t-shirt. And there is nothing more beautiful than Pappy.
Thanks. Hi, I'm Adley Wertman. I'm going to be a little unique today in two ways. First of all, I'm a business school professor at a homeless conference. And second of all, I'm a professor with no slides. So I have been, though, working on, for the last 22 years, on the issue of how business models, and social enterprise can alleviate poverty and homelessness. And the way we work on it is through something called social enterprise. So let me just give you a quick definition, at least from our side, of what social enterprise is. It's actually quite simple, meaning it's an earned income model, meaning not focused on and reliant on charity, an earned income model that is intentionally built to solve a social issue. I got it? So it has to earn income, and it has to be built intentionally and run intentionally to solve a social problem. Housing, affordable housing, happens to be the original social enterprise, right? It solves a problem, intentionally built literally to solve a problem, and it earns income through rent. We have now moved that very far forward around the world through microfinance and other ways, and specifically talking about workforce development becomes a perfect place for it. A few things that I just want to point out. One is this housing that we've been talking about across the board is not free. It requires that people pay rent. And in America, the only way to pay rent is to have a job. So somehow or another, for a majority of the people that are on the street and are homeless and living in their cars, we are going to have to somehow move them into the workforce. That move into the workforce is not a simple move. It is complex. It requires a lot of help. It is not something that any one agency can do alone, but there are agencies out there and organizations out there focused just on that. These really work best as social enterprises for transitional jobs, meaning what is that first job that you get when you're coming off the streets, you're coming out of jail, before you're ready for the next job, before you're ready for a more permanent job. And this solves two problems for people. Problem number one that it solves for people is a lack of any resume. So it allows them to build a resume, to not say I haven't worked in 20 years, but rather to say I'm working now, but I want a better job. And the second thing that it solves is it's the best way to teach soft skills. It is the best way to teach people how to get up in the morning, how to go to work, how to deal with a boss that's an ass, how to deal with the community, and how to, and truthfully, in some cases, what is a coffee break? And in some cases, what is an alarm clock? So there's no way in the world that we are going to collect enough money from donors, from kind-hearted donors, to pay people to work for us. There's no way we're going to make work for people that is going to employ thousands and thousands and 10,000s of people. The only way we're going to do it is by starting these intentional businesses who are built to provide transitional jobs. The point is, those are businesses. They are not social service agencies, though they act like them, and they are also can be, and most of them are nonprofit, but they're really run, taste, look, and act like a business. To build that more and more, to build this, this industry so that we have more of this, we need to do more things. So the first part of the workforce that I wanted to mention was the part where we talk about moving homeless people into the workforce. The second part is, how are we moving people into these businesses that we're talking about? We need to create the talent that does that. And I am sorry to say that I am the only business school professor here today. Because the answer is if we want to move people into creating, running, and working at these social enterprises, they need to have the exact same skill base as their competitors. And every one of them has private sector competitors. So what we're doing here at USC is we are building programs, we are building degrees, we are building minors, we are building fellowship programs specifically to train, support, incubators to support students who want to use business skills and a business degree to solve problems like homelessness, by working at and building social enterprises. And I'm really proud that I look around the room and see many of the alumni from our program, from agencies building low-income housing to job agencies to youth agencies across the board. What do we need? We need partnerships from government and business. We need proactive ideas that say, what jobs do I have? What contracts do I have? What capacity do I have that could contract with a business that would use that job to hire and train people in transitional jobs out of homelessness. We need government and businesses and donors to provide incentives to these businesses and governments to hire and contract with these organizations. We've already had this year brilliantly, the County of LA build a special preference on contracts where the bidder on that contract is using that contract to provide jobs for people who have multiple barriers to work. And lastly, we need the talent. So I just want to offer up that when you look at people and meet people who say, I want to go into this world of social impact, that you offer up one other opportunity. You can do it with a business degree, not just the traditional degrees. We want to be at the table. We are no smarter than anyone else. We are no better than anyone else. We don't believe that business has the answers and others don't. But I believe that we have a new paradigm and a different paradigm of thought processes to bring to the table, and we want to be there with all of you. Thank you.
Good morning. One of the reasons I'm running around today is because of our tremendous growth, so I apologize for being late. Okay, so my name is Veronica Lewis. I'm the director of the Homeless Outreach Program Integrated Care System, better known as HOPICS, which is the division of special service for groups that provides an array of homeless services in South LA, Compton, and Linwood. And I was asked today to talk to you about what the impact on our organization has been with the tremendous growth. And so I'm sorry I wasn't here to hear Sarah's comments, but I'm sure she painted the picture of just the unprecedented amount of expansion that's happening across the board, not only at the service provider level, but obviously with the agencies that are administering the dollars. And so I want to give some perspective about what the process has been like, what some of the challenges are, and some of the ways that we are working to address it. I was very glad to hear the professor talk about some of the things he did, because workforce development and preparation of some of the students is really critical, and we're seeing that we need to target some of our efforts to ensure people understand this sector. So I'll give you our story a little bit to help you understand the impact. And so HOPICS, we've been around, this is our 30th anniversary actually, we're celebrating 30 years. And we started out in 1988 with a $60,000 grant, and of course we've grown since then. But within the last 16 months, our budget went from $15 million a year to $30 million a year. We went from 80 employees to 210 employees within a year's time. And so the bulk, 98% of that unprecedented growth is as it relates to the work that's being done to try to help men and women get off the street faster. And so naturally, we've had a lot of growing pains, and not only from an organizational perspective, but just as a system, as a part of the leadership of the system, as we develop policies and things like that, there's just a tremendous amount of challenged with trying to take something to scale at such a rapid pace. And so some of the things we've been doing in terms of staff recruitment is because we're in a space of collaboration, we have to be very careful about just not stealing other people's employees. And so it's a really challenging environment. And, you know, I've gotten some dirty calls, some dirty looks, and some calls where people are upset with me because we didn't know they work for something. But I mean, we're trying to be respectful. And my colleagues and I have talked about this. Like we're trying to be respectful and not just grab talent that we've seen from our partners. And so what we've tried to do is obviously engage with universities like USC. We've also honestly tried to look back into the coffer. So some of the clients that we've served years ago that we know completely understand what the experience is like, completely understand what the people walking through our doors are going through. We've tried to reach back in some cases and see, you know, if they're interested in doing some of the work that we're doing. And then, you know, we've done the traditional social serve and things like that, and it really hasn't yielded a lot of result. And so at this point, we're trying to get very creative about looking into other sectors, obviously, because there's, you know, hundreds of people that have to be hired across the system. So some of the things that we've been working on is really trying to understand people who have a customer service lens. So many of the new folks we brought into our organization that don't have homeless services experience but have deep customer service experience, we feel that's a transferable skill. And so that's where we've shifted our focus most recently, trying to figure out how do we bring in people that have transferable skills. Along with that, though, comes a lot of challenges because this is a very nuanced population. And so one of the things that has been critical for us is to ensure that the people walking through our doors understand them. And so part of the strategy is not only for us to take that on as a service provider alone, but working with our partners like LASA and the Department of Health Services and those folks to say, like, hey, we need some help. Can we have a system-wide training? Can we have some, there's a commonality across the different organizations that are facing the same recruitment challenges we are. And so our public partners have been very helpful in terms of really trying to provide resources to take the training, the technical specialized training to a regional level. And so we've been working on that in particular. Some of the challenges that we're facing, though, just in general as it relates to ramp up. And so when you have more than 50% of your workforce that are all in introductory status, that are all brand new, that you're still trying to understand you know, their work ethic and their level of integrity and things like that, it creates a tremendous amount of challenges. If I can only tell you what the last 30 days has been like for me as it relates to personnel, you would not believe some of the stories that I have. And so I think that some of the things we're trying to look at is there anything we can do at the recruitment phase to possibly better understand some of the non-resume attributes of this client? And so we're working on trying to figure out, looking at some of the corporate models. I know when I was in college and I worked for Bank of America, they asked me some questions like, if there was money on the table and nobody was looking, what would you do? And so those types of tests exist, and our corporate partners use them regularly. And so we're looking at whether or not, we can use those. And then some of the other challenges, just trying to maintain quality control when you have that many people doing all kinds of different things has really been a challenge. And so trying to put fail-safes in place, and this is something that we're really working on internally, and we're not quite there, but trying to put fail-safes in place so that, even if a person is out and even if this person didn't come today, like, do we have competent systems in place so that we can make sure that we're in contract compliance? But what are we doing to address those things? I just got the 2-minute warning. So we've decided to do like a fully blown comprehensive training for all of our staff that I'm personally facilitating. It's today, which is why I was running, and I'm going back, and they got an extended break where I'm directly, they got an hour and 45 minutes where I'm directly imparting information about these are the performance standards, this is how we work, this is who we are, this is the context that you're working within, this is how your programs intersect, this is how we work. I mean, because those kinds of things are invaluable, and we've learned that if you come and just give somebody their job description, that doesn't work. Within the landscape we're working in, people need to understand it. And so I'm investing my personal time, and it took me 40 hours to develop the curriculum, but I realized that if I want them to be to the standard and want to control the quality, then they need to hear from me directly, and they need to be able to bounce questions off of me. So the senior management of our organization is working to really make sure everybody understands the context. And then finally, one of the specific strategies to help people that with homeless experience re-enter the job market is, like I said, we are hoping to develop a program for many of the people, for instance, that are on CalWorks that are a part of these subsidized employment programs. We're hoping to work with the public our public partners to maybe have a specialized program for them. So you all know how like they have vocational trainings with hazmat and all the janitorial services and all these other things. And so, we're hoping and pushing that because we have a labor pool deficiency, and because we have lots of folks with lived experience that are trying to get into the workforce, let's develop a training to build their skills so that we can move them into, I think that's Reba, move them into our workforce, but they can't just come, but we need some skills development. So we're hoping that we can have a win-win for people who are currently recipients of entitlement benefits, and the service provider pool who's looking for candidates who understand the experience, but there's a medium part. And so we're hoping to develop some training like that with our partners very soon. Thank you.
Thank you all, and we're so happy that you made it through the traffic and so forth. Really, we have before us presentations that speak to an extraordinary new toolkit, a lot of new things in the toolkit for dealing with homelessness. And I want to start by asking the panel, and Adlai, you talked about being the only business school professor here. What are the impediments, the structural or systemic impediments of a market, looking at solving this problem through a market-based capitalist lens? What are the impediments there, structurally or systematically, that we need to address, whether it's in housing, whether it's in workforce development, whether it's in the business of healthcare, the business of providing healthcare, and the way in which that's conventionally provided? Wonder if each of you could take that on from your own perspectives.
Want to take a shot?
Okay. So, I think that, and I'm sorry, I thought you were addressing the question to him. So can you repeat the main point of your question?
Sorry, I can answer it.
Does the market-based lens from which we look through, the for-profit lens, if you will, that we look through to solve a lot of problems, does that present impediments for some of the work that you're trying to do?
Yeah, I think so. I mean, I think that as it relates to staff recruitment, as it relates to just building the system, I think that this is a very special field. I think the customer service principles and some of the quality control principles, those things don't change. That, I mean, it's just the technical part of what you're looking at. I think those principles are helpful, and I actually think we need to use a little bit more of those principles, honestly. That's what we're looking at in the nonprofit world. But in terms of the staff recruitment, I think that's the most challenging for us. As I said, we've tried some of the traditional avenues to recruit staff, and it really does take, first of all, people with commitment to want to do this work, people that have compassion for people that we're serving. And so I think, we can't just go by some of the resumes we're getting in where people are very well versed and people really have lots of experience. I mean, there's a very specific attribute that we're looking for. So it has been a challenge in that way.
Sure. Interestingly enough, I was speaking at a conference at the UN last week about CSR, corporate social responsibility, and how corporations can engage. And I would say that 4 years ago, if I was at that conference, I would have heard nonsense, a lot of self-congratulatory. I'm really happy to say that this time, and we had CEOs of Fortune 100 companies talking about how they really are now engaging in this issue, and they're trying to learn more and more about how to creatively do that. If you said the word, "our foundation gives out money," you were shunned from this group. But you looked at issues like MasterCard talking about how hard it is for homeless people and poor people to have to deal with cash. And they're looking to figure out ways to solve that problem by eliminating cash from this system and giving people access to plastic, which they could never use before, and stops violence and stops them from getting robbed. And hearing other organizations, Allstate, talking about how they see domestic violence causing homelessness, so they're addressing domestic violence because people with homes is what Allstate is about. So I'm really happy to say that not just social enterprise, but I'm really seeing the large corporations come to the table with resources that are way beyond what we could possibly put together in this room.
And maybe I'll add to that because I'm going to try to compress questions because we have a lot from the audience and I want to get everyone involved. Is there compassion fatigue in some of the work that some of you are doing? Very difficult work on the ground, and again, in terms of impediments to getting the job done.
Yes.
Yeah,
self-care is really something that we're trying to figure out how to incorporate. Like, so we've implemented like a meditation. I mean, yes, they are. The folks that serve this population are hearing some very difficult stories every single day, and so yes.
Yeah.
For us, there definitely is compassion fatigue, but one of the things that I found helpful is that when we go out on the street, it's important to remember who we're going out there for. So when I go out there, I try not to think anything about myself. It doesn't matter if I'm tired, it doesn't matter if I'm overwhelmed. It's for the patient. So I focus completely on the patient, and that helps over time.
Yeah, just to sort of echo what Veronica was saying, I think that's definitely true, and I think it's part of why with the trainings really and just as our system as a whole, really looking at how do we make sure that there's trauma and resiliency, like informed care as a part of all of our work. And that's to support both the people that we're working, but also the people that we're serving, but the people that are doing that work, and understanding that, there's vicarious trauma, and how do we create safe spaces for the staff that are doing this work to be able to process that and support each other.
Another question is, how do you integrate persons who have been homeless in thinking about designing, developing pathways for them to get into the workforce? And one question I had amongst others is the educational component. You talked about moving folks into the workforce. Where and what delivery system is at work in terms of delivering education?
Good. For us, I don't know that it's as much of an education, but just complete involvement of people with lived experience, especially where for street medicine, there's really only, you can run a whole program off two people. One, you need somebody to deliver the medical care, and two, you need somebody who's a street guide, who knows the streets well. And the folks with lived experience are the best people to do that. So they can tell me where to go, who's sick, if there's any area I need to stay away from. And then when I'm physically with the patient, I can focus on the patient, and they have the situational awareness to the environment. The trick is figuring out a way to get them properly reimbursed for that.
So I think diversity amongst the staff that is serving our community is really important. And so I talked about earlier that we're reaching back and trying to see, but I think a hybrid approach. And so we definitely have people who have lived experience. We have paraprofessionals like substance use counselors with certifications and other types of certifications, and clinicians and everything in between. And I think that one of the things that we really try to stress within our own organization is everybody has value, whether it be education from a university or education from life. Everybody has value, and so I think we need everything. I think that some of the other ways we're exploring is possibly a lived experience council within our region, to really look at what we're doing, look at our effectiveness, look at whether or not, we really are delivering the service in the way that's most meaningful to the folks that we're serving. I think in terms of the educational sectors, obviously the schools of social work, the schools of public health are contributing, but some of the things we're trying to do too is encourage people's professional development. And so within my organization, since we do have a lot of folks that are non-degreed, a couple of times over the last year, I've had an education counselor come in, and they have 30-minute sessions with them, and they can talk to them about all the different options. And I'm proud to say that, like, within the last 5 years, we've had at least 10 to 12 people secure their bachelor's degrees. And so, we're Yeah, thank you. So we bring them in, but also if they're willing to and interested in, then we make opportunities for them to further their education.
Yeah, I want to give a shout out to the community college system. These are, I grew up in Queens, and in New York we used to have vocational high schools, and they went out of favor for tracking students, and suddenly we weren't giving hard skills to some people. And I think the community college system has become a phenomenal opportunity. What I've been able to see community colleges do is find a gap in the market, create a program, train hundreds of people, and 3 years later they've got people and they're filling those gaps. No university is able to be that agile, so I think that moving people through the community college system is really a great opportunity for all of us.
If I can just add, I think also one of the partnerships we've been working on for the past couple of years that continues to grow is really with the workforce development system. And that's a partnership two ways. One is to really be making sure that the workforce development system is accessible to people who are homeless or formerly homeless, and really helping to open up those doors and making sure that those services are getting access. But then on the other side of that is been working with the workforce development system on really seeing the homeless service system as an industry, and that we're an industry that they are helping to train people for and direct people to. And so there's been a lot of work on that. And then they know that we have this centralized training academy so that people can get the specialized training within homeless services within that, and they can get sort of the other kinds of job supports that are available through the workforce delivery system.
This is going to be a lightning round because we're out of time. Very quickly, in terms of that reverse situation of trying to forestall people moving into homelessness, are there things that you're doing to try to keep people in work, in homes, in stable situations so that they don't move into homelessness? Because I know one question was the sharing economy and how that is, that flexibility is presenting problems, but that's just one example. But very quickly, if there's any quick things you can say.
So unfortunately, based on data we saw earlier this week, the inflow of people is exceeding the exits into permanent housing. And so we know that that's a factor. I think that, there's some very innovative things that are happening. And so we are doing a lot of diversion work, for instance. And so we are paying people's bills if they upset their grandma. We're paying a utility bill to try to mediate that, or doing conflict resolution. And we're sending people, we've sent somebody as far as Maine at this point, pay for their accommodations to get there because they would have a permanent place to stay. And so I think we're moving in the right direction. The economic piece that the homeless services system cannot really address, I think we have to grapple with maybe outside of this space. But yeah, we're trying, but we definitely need more interventions.
So just to build off that, so there was some funding through Measure H for doing diversion and prevention work. So it's certainly not enough to meet the need, but that is all in place now for all populations. But I think beyond that, it's really about continuing to work with other systems of care and helping to sort of stem the flow of people from other systems of care into homelessness. And so Corinne was on the panel earlier talking about the work that's happening within the Department of Health Services and the Office of Diversion and Reentry. That's really important work. There's also some really great pilots that are happening now with DCFS, where case managers from the homeless system are actually helping to participate in case conferencing for discharge planning, so that youth aren't getting discharged out of the foster care system into the homeless system. So just continuing that kind of work.
Thank you. Please join me in thanking the panel.